pressure on the same area, much like a callus forms. Have you guys had a callus on your finger from writing? I have one. I always have one. Or exactly, feet. I forgot. Yes, of course. Yeah. And then it forms, yes. So on areas of a person's feet that are irritated by tight socks, point shoes, etc. And the voice of a person who has nodules usually sounds hoarse, low-pitched, and kind of breathy. Vocal polyps. So I know that this is a pink area right here that's sticking up a little bit more. It's similar to a nodule, but it's softer, more like a blister than a callus. I know, painful. It most often forms on only one cord, and they are often associated with cigarette smoking, but may be linked to hypothyroidism, so decreased activity of the thyroid gland, which is involved in growth and development in children and energy control in adults. Gastroesophageal reflux can cause polyps to occur, or chronic vocal misuse. You're constantly misusing your voice. And I think that's what Adele had. And she, on YouTube, like they interviewed her before and after the surgery, and she sounded completely different. So, people who develop a vocal polyp usually have low-pitched, hoarse, breathy voices, similar to those who have nodules. Laryngitis, this is kind of more like a familiar one, is an inflammation or swelling of the vocal folds, and it may be caused by excessive use of the voice, by bacterial or viral infections, or by irritants such as inhaling chemicals, or the backup of the stomach into the throat acid, which is gastroesophageal reflux disease. The voice of someone with laryngitis will often sound raspy, breathy, and hoarse. So, contact ulcers are a less common vocal disorder. They're experienced by people who use too much force when bringing the vocal folds together for speech. So think of contacting too much pressure. This excessive force causes ulcerative sores or wearing away of the tissue on or near the cartilages of the larynx that move to bring the vocal folds together for speech. These ulcers are also found in people with gastroesophageal reflux. They often develop after a cold or a viral infection or during times of increased stress, tension, and voice overuse. People with this type of voice disorder often complain of their voice tiring easily, and it may be really painful when they're speaking. Vocal fold cysts are collections of fluid and sac-like formations on the vocal folds that typically occur after an upper respiratory infection combined with vocal fold overuse. Vocal cysts can cause diplophonia, so hearing two pitches at the same time, two or more, when a person speaks. It's kind of crazy. You can hear the person's pitch go kind of back and forth, and you're like, but it's like simultaneous, if that makes sense. So it's weird, you're caught off guard. But it's a condition where the vocal cords produce multiple tones at the same time, or dysphonia, like I said earlier, which is just an impaired quality of the voice, typically involving hoarseness or a breathy sound. My little. Varying your voice's pitch, there are 4 vocal registers: the glottal fry, normal phonation, falsetto. Any singers know, high is falsetto, or whispering, which is actually just as damaging as yelling. I'll talk about that a little bit. And which register puts no strain on their voice? Whispering. Prevention of voice disorders, also known as vocal hygiene. I won't read all the titles, but we all already talked about vocal abuse. So stop yelling, stop shouting. Instead, use a whistle or clap your hands. Avoid lengthy conversations at work or at home or on the phone. Don't speak with excessive background noise around you, and minimize talking, if you do have excessive background noise. Or go somewhere else with the person or people, like a different room in a quieter environment. Hydration, so water obviously lubricates your vocal folds, which increases their ability to perform to their highest laryngeal cancer is a lot of the times is caused by this. So, and people's vocal folds actually turn a gray color whenever they're smoking. It's gross. Instead of pearly white like they're supposed to be. Use the proper vocal register. Don't speak in falsetto all the time. Don't whisper. Don't use auto cry. Just use your normal voice. Throat clearing. Why are you clearing your throat? I do it just based off of habit, but I become more aware of it. It might be because of dehydration, excessive mucus, in like the springtime, your allergies, you have a cold, you have the flu. It's better to cough lightly once than to clear your throat multiple times. So make that cough a big one and then just stop. Vocal rest. If possible, give your voice plenty of time to recover from the near constant use in the school environment for teachers. But for everyone, rest your voice for 10 minutes every 2 to 3 hours during prep periods, breaks, school. Just give yourself time to unwind and let your voice unwind with you. Keep talking to a minimum if your voice hurts. Don't try to suck it up and bear with it. Don't do it. Avoid dry or smoky environments. Even traveling to the Southwest could be a bad idea due to the lack of humidity. If you suspect, so it could be a bad idea going somewhere dry if you suspect you have a voice disorder, because it will make it worse. Be aware of medications that dry out the mouth and throat. So decongestants, antihistamines. I take Claritin every day, and I notice I drink so much water, Gatorade, etc., because I'm so thirsty. Decongestants like, any pseudoephedrine or Nyquil. Anesthetic and local anesthetics. Several of these are taken by people who are experiencing a cold, and they just dry out the vocal tracts completely. Reflux, the gastroesophageal reflux disease. Avoid all drinks that have caffeine, because caffeine leads to dehydration. And then humidify the air in your work environment if you feel as though it's a factor of why your voice is going in and out. Okay, so instructional care. So this is for the professional or for the student in your case who wants to maximize his or her vocal function, so the range of his or her voice, the pitch, or the or the loudness of his or her voice. So, like I'm doing right now, I would inform this person on all aspects of vocal hygiene, how exactly the voice works, and what kind of damage can be done to the vocal mechanism, like the larynx itself, and breathing techniques that can help singers use their air wisely and breath support, and minimize. Just telling them about vocal hygiene as well. So for my profession, people may come to me if I wanted to specialize in voice, just for goals and techniques to work on in order to kind of gain their voice back or make it better, or find out what exactly is going wrong with their daily routines. Okay, so a team approach is usually involved with this. So unfortunately, it's best to see an ear, nose, and throat doctor, or aka an otolaryngologist, or a laryngologist who specializes in throat disorders. Before, I can't see them without a referral to me, so it's good to go to your physician first. Those three are probably the best ones to diagnose potential voice disorders, and then I will provide the voice therapy and attend to the problem that affects this person's speaking voice. Other team members may be from any one or more of the following professions: singing voice specialist, acting voice specialist, nurse, or physician assistant, a consulting physician, or a non-physician specialist, So my role would be, I would examine, after the client has been examined by, it's most likely the ENT, I would take baseline voice documentation or data, do an acoustic voice analysis, meaning hearing their voice and using different types of equipment to measure their prosody and vocal range and their frequency, all this, the diagnosis and perform speech or voice therapy and determine like when the dismissal criteria should be. So, like I said, use your voice wisely. So avoid cradling the phone like when you're talking, because this posture can cut off one of those, the airflow needed in order to speak optimally. And it does strain your voice when you do that, because you yourself are strained in this position. It's not normal. Consider using a microphone when appropriate. So static environments, classrooms, exercise rooms, and a lightweight microphone and an amplifier speaker system can be of great help. You won't have to talk loudly. You can just talk in your normal voice and turn up the thing as loud as you want. Consider voice therapy if problems are not subsiding by doing these compensatory strategies. And speech pathologists can help teach you how to use your voice in a healthy way. Like I said, if you suspect someone of having a voice problem, see your physician, so your ENT most likely, and request a full voice evaluation. A speech language pathologist can provide voice therapy to an adult or a child, but only with physician referral. So here's some websites where you can find additional information about voice and voice disorders. There's NIDCD, which is like the National Disorders of Communication, something like that. But if you want me to write down a link for you all, I can do that on your handouts. And on this website, I already type in, voice disorders, spasmodic dysphonia, speech language pathologist, ENT, anything voice related, and you'll find out probably more than you ever wanted to about where my references. Thank you for listening. Yeah. You guys have been great.